Bismillahirrahmanirrahim. Today we will discuss about the adult onset still disease. So, what is adult onset still disease? Adult onset still disease is a systemic inflammatory condition. It is a systemic inflammatory condition, and the actual cause of this disease is unknown, but it is thought that any infection can trigger the adult onset still disease. Infection can trigger adult onset still disease, but the exact cause is unknown. Exact cause is unknown. Is unknown. Adult onset still disease is a triad of fever, means there will be fever, there will be arthralgia, and there is episodic rash. Episodic rash. Now there are two terms. One is called the still disease and the other one is called adult onset still disease. So what is the difference between the still disease and the adult onset still disease? Still disease is also called the juvenile idiopathic arthritis, or it is also called the juvenile rheumatoid arthritis. The symptom and sign of still disease does not resemble the rheumatoid arthritis. So juvenile rheumatoid arthritis is a misnomer for the still disease. Still disease occurs before the age of 16 years. And rheumatoid factor is negative in the still disease, while the ANA is positive in some cases. ANA is positive in some cases. So still disease occurs before the age of 16 years, and it is called the juvenile idiopathic arthritis or the JRA, the juvenile rheumatoid arthritis. Rheumatoid factor will be negative in this condition and A is positive in some of the condition. While the adult onset still disease, it occurs before after the age of 16 years, means beyond the age of 16 years. For the diagnosis of adult onset still disease, Yamaguchi criteria is used. Now we will look what is the Yamaguchi criteria. Now Yamaguchi criteria, there are major criteria and minor criteria. Major criteria include the fever. This fever occur daily, so it is called quotidian fever, more than 39 degrees C for 1 week, for at least 1 week or more. This is one component. The second component include the arthralgia. Arthralgia for more than 2 weeks. Third component include the rash, and the characteristic of this rash is this will be salmon colored non-pruritic rash, and this rash usually occur with the fever, and when the fever subside, this rash disappear. And the fourth component is the leukocytosis. Leukocytosis, that is more than 10,000. So fever, arthralgia, rash, salmon color rash, and leukocytosis. These are the major criteria. Now the minor criteria include the sore throat, sore throat. Second minor criteria, lymphadenopathy. The third minor criteria include the hepatosplenomegaly. Hepatosplenomegaly. The fourth minor criteria is the abnormal liver function test. Abnormal LFTs. And the fifth minor criteria, negative rheumatoid factor. Rheumatoid factor should be negative in this condition, and ANA should be negative. To diagnose Yamaguchi criteria, you have to exclude the rheumatoid arthritis by doing the rheumatoid factor, and you have to exclude the ANA. This should be negative. So there are 4 major criteria and 5 minor criteria. And for the diagnosis, there should be 5 out of these 9 criteria, but 2 must be out of the major criteria. So 5 total criteria, 5 total, including 2 major criteria. But since fever, arthralgia, rash, and leukocytosis can occur with the viral infection, it can occur with the malignancy, and it can also occur with the other autoimmune condition. So first you have to exclude the infection, you have to exclude the malignancy, and you have to exclude the autoimmune condition like the rheumatoid arthritis and SLE. Then after you exclude the malignancy, infection, and the rheumatoid arthritis and SLE, then you can use the Yamaguchi criteria for the diagnosis of adult onset still disease. So you have to exclude the infection, you have to exclude the malignancy, and you have to exclude the other autoimmune condition like the rheumatoid arthritis and the SLE. There are 3 phases of adult onset still disease. It could be monophasic. Monophasic form will last from weeks to months, but this disease do not recur. The second is the polyphasic form. Polyphasic form, there will be relapses and remission. And the third one is the chronic persistent disease. This disease do not go into remission. So these are the 3 forms of the adult onset still disease. The complication of adult onset still disease include the macrophage activation syndrome. About the macrophage activation syndrome, we will record separate videos. Now, how to investigate a patient with adult onset still disease. This includes the complete blood count. Complete blood count will show anemia of chronic disease, and it will also show the leukocytosis. Since this is an inflammatory condition, the ESR and CRP will be raised. Serum ferritin is very high in this condition, and it should be in 1000. And rheumatoid factor and ANA should be negative in this condition, because for the diagnosis of adult onset still disease, you have to exclude the rheumatoid arthritis and the SLE, and you can do the ultrasound for the hepatosplenomegaly. Now the treatment of adult onset still disease include the NSAID, steroid and the DMARD like methotrexate, anakinra, and other DMARD. So the first line treatment is the NSAID plus minus steroid for mild disease. If there is mild disease, you can try first the NSAID along with the steroid. For moderate to severe disease, the IL-1 antagonist like anakinra or IL-1 antagonist canakinumab. These two are the for moderate to severe disease. And if there is macrophage activation syndrome, then you can give the anakinra plus steroid. So the first line treatment is the NSAID. This is the treatment of adult onset still disease.